Hello friends, we are going to discuss about the top 25 questions of anatomy. The first one is adductor canal has or what does adductor canal transmits? The answer is saphenous nerve and femoral vessels. Second number question, injury to which of the nerve lead to the wrist drop? The answer is radial nerve injury lead to the wrist drop. Third number, accessory spinal nerve innervates where? The answer is trapezius. Fourth number, Hassel's corpuscles is present in the question mark. The answer is at the thymus. Fifth number question, tubercles of Montgomery are present in question mark. It is present in the breast. Sixth number question, nerve supply of stapedius muscle. What is the nerve supply of stapedius muscle? The answer is facial nerve, that is seventh nerve. Seventh number question, Clara cells are found in? The answer is bronchioles of lungs. Eighth number questions, the nerve supply of adductor pollicis muscle is? The answer is deep branch of ulnar nerve. Ninth number question, morula is a dash cell stage. The answer is 16 cell stage. 10th number question, placenta is formed from? The answer is decidua bacillis. Then decidua bacillis forms the placenta. Then what does decidua capsularis forms? What does decidua parietalis forms? And what does decidua menstrualis forms? Then decidua capsularis surround the chorionic sac, and decidua parietalis the endometrium during pregnancy except at the site of the implanted blastocyst. And decidua menstrualis the layer of the uterine endometrium that is shed during menstruation. 11th number question, stapedius muscle develops from? Stapedius muscles develops from second bronchial arch. And 12th number question, muscle derived from second pharyngeal arch are? The answer is posterior belly of digastric muscles, and they are supplied by the facial nerves. Then 13th number question, muscle derived from the third pharyngeal arch. The muscle which is derived from third pharyngeal arch, the name is stylopharyngeal muscles, and it is supplied by the glossopharyngeal nerve. 14th number, muscle derived from fourth pharyngeal arch. The muscles which are derived from fourth pharyngeal arch are muscle of pharynx, larynx, and soft palate, and these muscles are supplied by the superior laryngeal nerve. Muscle derived from fifth pharyngeal arch. The muscles which are derived from fifth pharyngeal arch are muscle of pharynx, larynx, and soft palate, and they are supplied by the recurrent laryngeal nerve. Then 16 number question, muscle derived from first pharyngeal arch. What are the muscles that are derived from first pharyngeal arch? The muscles are anterior belly of digastric muscle, tensor tympani, masseter, temporalis, tensor palati, medial and lateral pterygoid, mylohyoid, and these are supplied by the mandibular nerve. 17 number, action of muscle of the hand. The first number, thinner and hypothenar muscle, they help in the deepen and hollow and palm during gripping. They help thinner and hypothenar muscles help in the gripping. Then lumbricals and interosseous muscle together help in flexion of metacarpopharyngeal joint, extension of interpharyngeal joint. Then the palmar interosseous muscle help in adductors of fingers, and dorsal interosseous muscle help in abduction of fingers. Then 18 number, the highest point of iliac crest correspond at the level of which spine? The highest point of iliac crest correspond at the level of L4, means lumbar forespine. The cartilage of epiglottis is? The answer is elastic cartilage. 20 number question, which of the following is true about McCall diverticulum? The 3 points are true. The first point is its length is 2 inches. The second point is it lies 2 feet proximal to the ileocecal valve, And the third point is it occurs about 2% of the population. Then the 21 number question. The accessory cervical rib cause compressed of? The answer is first thoracic nerve. And what is thoracic inlet syndrome? Thoracic inlet syndrome occurs when the subclavicular artery and the first thoracic nerve are pulled or pressed by the cervical rib or by abnormal insertion of the scalenus anterior muscle. 22 number question. Muscle producing movement of mandible. The first muscle is lateral pterygoid muscle. It helps in depression and protrusion of the mandible. The second muscle is medial pterygoid muscle. It helps in elevation and protrusion of the mandible. And the side to side movement of the mandible is helped by the lateral and medial pterygoid muscle. And retraction of the mandible is caused by the posterior fiber of temporalis. 23rd number of question. Which of the following develop from ectoderm? The answer is iris muscles. 24th number question. Peripheral heart is another name of? The answer is soleus muscle. Soleus muscle is also known as the peripheral heart. 25th number question. Action of sartorius muscle. The first action is flexion of the thigh and leg. The second action of sartorius muscle is abduction of thigh. And the third action of sartorius muscle is lateral rotation of the thigh. Thank you very much.